Thank you for joining us for this COVID-19 and vaccine town hall sponsored by Grand Valley's Virus Action Team. I'm Dottie Barnes, the Associate Director of University Communications, the Associate Director of News in University Communications, and I'll help moderate and as we get answers to questions, you may want to use the Q&A near the end of this town hall if you have more questions. We received nearly 500 questions and we've kind of grouped them into some themes and some were duplicates. So hopefully we'll be able to get to most of what you need answered. And we had more than 1,000 people registered for this town hall. So obviously many of you want to know about vaccines, and our panelists will be able to answer most of your questions, hopefully, as we go through this next hour. So I'd like to introduce our panelists. We have Greg Samuel. He's Vice President for Finance and Administration and Director of the Virus Action Team. Habiba Fidel is our Associate Vice President for Academic Affairs and a member of the Virus Action Team. Adam Tate, Facilities Manager in Housing and Residence Life. Kate Harmon, Director of Recreation and Student Wellness Initiatives at Grand Valley, and she's a member of the Virus Action Team. We also have Tina Barnakow, our Senior Director for Health in the Office of the Vice Provost for Health and a member of the Virus Action Team. Marcia Mansoray is the Deputy Health Officer at the Ottawa County Department of Public Health. She oversees epidemiology, emergency response, and public information sections. And since March of 2020, Marcia has helped lead the COVID-19 Incident Command Team's response to the pandemic in Ottawa County. And Dr. Habiba Hassouna is a board-certified infectious disease physician at Spectrum Health. She serves as medical director for the Solid Organ Transplant Infectious Disease Program and the associate program director for the Infectious Disease Fellowship Program at Spectrum and Michigan State University College of Human Medicine in Grand Rapids. She serves as an advisor to our Virus Action Team. I'd like to turn it over now to Greg Samuel for opening remarks.
Thanks, Dottie. And thanks to the entire Grand Valley State community. I can't thank you enough for everything that you're doing during this most unusual year that we've had dealing with COVID. But it's your efforts that I think have been able to make the Grand Valley our ability to deal with the virus throughout the time. It's your efforts. I know it's been uncomfortable at times and just inconvenient, but your work is just absolutely essential for us to be successful to eliminate the spread of the virus. The Virus Action Team, as Dottie introduced a number of the members of the team, represents a broad swath of the community. We have faculty members on there, we have administrators, we have people from student life, we have from our health, our schools of nursing are on there, and also Dr. Habiba Hassouna assists the Virus Action Team. So we're able to look at the virus action and the university response from a number of different angles because we have such a broad representation. Probably the question most of you have is, when is Grand Valley going to have their vaccination clinic on campus, and when can I make an appointment? Unfortunately, I don't have the answer to that right now, but I can assure you that we are continuing to work with the health department to figure out when we can do that. We're really limited by the availability of vaccine right now. But Grand Valley stands ready to have such a clinic when the vaccine is available, and we will coordinate that with the health department. We already have the freezer for the vaccines. It's ready to go. It's plugged in and holding temperatures as we speak. We've done some site visits with the health department, looking at various areas on campus where we could hold that vaccine clinic when we're ready to go. So we stand ready to do that as soon as we can. We just need more time, and I ask for your grace and your patience as we work with the health department to be able to set that up in the future. And with that, I'll turn it back over to you, Dottie.
Thanks, Greg. We'll get right to our questions. We had a question: what is the effectiveness of the current vaccines against COVID-19? Dr. Hassouna?
Yes, so today I just want to mention that we're going to focus mostly in our discussion about the current available messenger RNA vaccines. The two vaccines that we've been hearing mostly about and are available are the Pfizer vaccine and the Moderna vaccine. Now, one thing that I wanted to mention is that when we mention the word effectiveness, it actually refers to how well the vaccine performed in clinical practice, or what we call the real world data, as opposed to efficacy, which is the terminology that we use in clinical trials. If you ask me about the vaccines, I would say that both vaccines are remarkably efficacious in terms of the effectiveness, and they're quite similar. Both of them has remarkably showed efficacy in terms of preventing symptomatic COVID-19 infection, and most importantly, the severe cases of symptomatic COVID-19 infection. Now, and that was based on clinical trials that were done included 73,000 participants between both trials with the Moderna and the Pfizer. If we have to compare those vaccines, as I said, they're really quite similar. And if we have to compare and contrast among them, I would generally say that Pfizer vaccine had showed that the vaccine is 95% effective in preventing lab-confirmed symptomatic COVID-19 infection in people who had or did not have a prior history of COVID-19 infection before. That was also comparable to the Moderna vaccine that had showed 94.1% efficacy in preventing that symptomatic COVID-19 infection when they checked people at day 14 or more after receiving that vaccine. This efficacy have actually been consistent when they even checked it among people of different age, sex, race, and even ethnicity, and people with different comorbidities and obesity, where still the vaccine was thought to be effective at more than 92% for Pfizer, and it was more than 86% for Moderna. And that was when they tried to look into people which considered to have maybe lesser immune response to that, which were the ages above the age of 65. It's important to mention that even after one dose of receiving that vaccine, there was still 52% efficacy with the Pfizer vaccine and 80% efficacy with the Moderna. That said, Moderna only followed those patients for 28 days when they talked about the first dose, so it's hard to interpret that. One important point that we have to mention is that, as we said, it didn't only prevent not only symptomatic disease, but severe cases. And this is why in those trials, they looked at patients and they found for Pfizer, 10 cases were severe cases. 9 out of those 10 were in the placebo, only 1 in people who received the vaccine. And for Moderna, they had 30 cases and 0 of those were in people who had asymptomatic. When we talk about mortality and death, they didn't specifically look into that, but there was preliminary data and some low data that did support that it did decrease death and hospitalization. And most importantly, the question that all of us are asking is, did it prevent asymptomatic disease? There's not enough data right now to support that they did prevent asymptomatic disease, but there's clinical trials ongoing. However, for Moderna, what they actually did is that they did find preliminary and small data that did show that it decreased asymptomatic infection. That was based on swabbing those people with no symptoms at the week 4 after receiving their first shot when they came for the second shot, and it did decrease the asymptomatic infection by significantly, and they only found the disease in 0.1% of individuals. So all in all, I would say they're really effective vaccines to receive.
And kind of as a follow-up question to that too, Dr. Hassouna, we have some asking about the current vaccines and their effectiveness with the variants of COVID-19.
This is a very important question, Dottie. Now, I would say currently there's limited information about how those vaccines behave against the new strains. And this is not coming at a surprise, because the time where those vaccines were developed, they were developed against the earlier strains. However, we do have preliminary data from both vaccines, the Pfizer and the Moderna, where the people in the clinical trials, they tried looking at the neutralizing antibodies against those new strains, which we're talking about the B117, which is the UK strain, and the B1351, which is the South African, and we have in lesser degree the P1 variant, which is from Brazil. And those vaccines did verify that they do have neutralizing antibodies against those strains, but they were less effective when comparing them to the earlier strains. But one important point that I really want to stress on today is that the discovery of those new variants should not change our recommendation on taking the vaccines. People should not say that, well, I should wait for a newer or a changed vaccine to take those current vaccines, because we are currently in a race with this virus. And the only way to win that race is by taking those vaccines in order to control the virus, because the virus will always mutate if we're waiting on more and more vaccines to come by.
Thank you. There's one more for you, Dr. Hassouna. Some are asking about the side effects of the vaccines, and should they be concerned if they have allergies or reactions to other vaccines?
This is a very important question, and I'm sure that it does have a lot of concerns for people. So let me first, we're going to separate this question into two parts. Let's just talk first about the side effects, and then we'll discuss the allergic reaction or the allergic history of allergies. To start with the side effects, let me explain how vaccines work. So the way how those vaccines work is that they teach our immune system how to recognize and fight the virus. And in order to do so, they might develop some symptoms such as fever. And this is their way of actually method of saying that we're protecting you from the virus. And this is why those two vaccines were referred to as reactogenic, which means they will cause side effects in the people that will receive them. And this is a way of reflection of the immune system or of the immune response that they are generating. When we talk about the side effects, both of them have similar side effects, whether the local or the systemic side effects. Mostly the side effects would be seen around 1 to 3 days after receiving the vaccine, and they would generally last for 1 to 3 days after they appear. Mostly they are seen after the second dose of the vaccine rather than the first. And interestingly, they were seen mostly in the young generation as compared to the old generation. And this is, of course, just because probably the explanation is that the immune system in the young population is better than the old. When you talk about side effects, let's start with the local one. So local, this refers to injection site pain, swelling, redness at the site. Some people did have lymph nodes or swelling under their armpits at the site of the same arm where they got vaccinated. And those, they looked, and I would say that more than around 90%, 80 to 90% of people who will take the vaccine will experience one local symptom. When we talk about systemic symptoms, are those symptoms then where we talk about fever, fatigue, muscle ache, body ache, that kind of systemic symptoms. And those also were seen around 50 to 80% of the people who will receive the vaccine. Importantly, what I wanted to mention for people is that there's subset, some people where they found a delayed reaction to the vaccine, which means they had itching or redness at the site of injection, and that was seen 5 to 14 days after the vaccine. So I don't want people to panic about it, just to be aware of it. Sometimes some people, it was treated with topical steroids or antihistamine. Now, one other thing that I also want to mention is that there were rare cases of Bell's palsy, or what we call facial paralysis, and that was seen with both vaccines. However, when they looked at those vaccines, they looked at and they compared it, those cases were not higher than the general population, so there was no link to the vaccines with that. Most importantly that I wanted to mention, there were no cases of Guillain-Barré, transverse myelitis. There was no link of those vaccines to infertility, to erectile dysfunction, and they didn't see that they caused any problems in pregnancy so far. We have to understand rare events will appear in the news. They're not only going to appear in the news. This is something new. They will be amplified. They have amplifying attention and worry disproportionate to the actual risk. And this is why we always have to keep that in mind and understand the risks are still far lower than the risk of getting COVID itself. Now, and there's an app called VSafe where it's asked for people who take the vaccine, you can report your side effects. And this is one way of us knowing and understanding more and more about the side effects. Now, when we have to talk about allergic reaction, I'll make it simple. The CDC divided that into 3 categories for people to know about that. First category is that individuals who had severe allergic reaction, immediate allergic reaction, or anaphylaxis to the first dose of the messenger RNA COVID vaccine, or any of its components, mainly the polyethylene glycol and the polysorbate. This one is considered a contraindication to take another dose of the COVID messenger RNA unless you meet with your allergist or immunologist. That said, we do not know if this allergy will be translated and a contraindication to other non-messenger RNA vaccines yet. The second category is those individuals who have severe allergic reaction to any other vaccines or injectable therapy, whether subcutaneous, intramuscular, or IV. Those are considered to be precaution to the vaccine, and this is where it's just advised that you discuss your risks and benefits of taking the vaccine in comparison to your exposure risk with your provider or allergy and immunology. The third category, which is probably the most one that people are worried about, if you have allergies to anything else other than those, bee venom, environmental allergies, allergies to oral antibiotics or other medication, or allergies to food, there is no precaution, no contraindication to taking the vaccine. The only difference is going to be for all those categories is that you will be monitored for 30 minutes after taking the vaccine as compared to the others that will be monitored for 15 minutes.
Thank you, Dr. Hassouna. That's such important information. We appreciate your expertise in taking us through that. So this next question, Marcia, I believe you would be able to answer. Some are asking, what's the best source to receive the vaccine? Should it be my doctor? Should I get it from the health department? Should I get it from Grand Valley? And how do I get on a list?
Good morning, Dottie. Thanks. Thanks for having me here this morning. Actually, right now, I want to kind of echo something that Greg said. Vaccine supply is very, very limited. And because vaccine supply is limited, we have to prioritize who can get it first versus who can get it later. And I can assure you, everyone who wants to get vaccine will be able to get it. It's just that they may have to wait until later to get it. So when your audience asks about where is the best place to get it, my opinion is wherever you can get it. Because the risk of getting COVID-19, as Dr. Hassouna said, is much greater than any risk with the vaccine. The vaccine is going to likely protect you from getting COVID-19. And there are so many things we don't yet understand about the virus and the infection. So following that, I would just ask our audience, and I think Greg talked about this as well, that everyone be patient and kind of approach this vaccination process with a generous spirit. And be grateful and glad that those who are most vulnerable, which are elderly and those in long-term care facilities, get it first. And those who are healthcare infrastructure that need to take care of the rest of us if we do get sick, they get it first. And then we begin to prioritize based on vulnerabilities. So, when we survey our community, most people say they want to get it from their doctor's office or they want to get it from a pharmacy. Right now, vaccines are generally being shipped to hospitals and to local health departments, and they're just recently beginning to ship them to some pharmacies like Meijer and Rite Aid. So if you want to get a vaccine, what you'll want to do is get registered on those various places on their list for getting notified. A good way to do that would be to go to vaccinatewestmi.com, and that's a West Michigan regional site. If you go to that URL/register, you can look at various places and there'll be links for you to register. If you're in Ottawa County, you can also go to the Ottawa County website. It should also be at vaccinatewestmichigan.com, but ours is miOttawa.org/COVID-19. And we have a big red button on that page and it says vaccine notification sign up. And so you put your information in there, you'll indicate your age, you'll indicate your race or ethnicity, and indicate your occupation or what group you're in. And based on who's prioritized at the time, we'll be drawing those samples from that. And every week we get vaccine, we never know how much we're getting or which brands we're getting, but we'll take a sample from that and send you an email with a link and say, hey, we've got a vaccine appointment for you. Click on this link. So that is the best way to get on the list, and you will eventually get an appointment. It just be being patient and waiting.
Thank you, Marcia. You may be able to help with this next question, and Tina as well. Will Grand Valley be giving out vaccines? Will we partner with the health department? And will participants be able to get both rounds of the vaccine?
Tina, why don't you start?
Okay, so Grand Valley won't be a direct recipient of vaccine through the federal or state distribution programs. However, we are part of the West Michigan COVID-19 Vaccine Collaborative, which means we work very closely with the health departments and the local hospital systems so that we can advocate on behalf of our community for vaccines as those different prioritization schedules come out. And then we will definitely partner with them in hosting a vaccine clinic or multiple vaccine clinics, as Greg alluded to in his opening comments. So, you know, we're fortunate that we have great partners that as we've been able to facilitate so for our health professions, faculty, and students, we were able to work with multiple partners to get vaccines for them. You know, which makes it move faster for our entire community. And Marcia, I'll turn it over to you to talk about that first and second dose process because it kind of varies.
Yes. Yeah, I just want to thank Grand Valley. I get to talk to a lot of the people that are on this panel today every week. And Grand Valley has been a fabulous partner in working with us throughout this entire pandemic, especially as we get to vaccines. So if we're able to hold a clinic at Grand Valley, like Tina said, we will be doing that. And we're making plans and we've had site visits, as Greg told you about. So as far as the doses, if you are able to get a first dose appointment, you are guaranteed to get a second dose at that location. Sometimes they are scheduling the appointment right when you make the first appointment, or otherwise when you arrive at the first appointment, then you'll schedule your second appointment. But that is a guarantee. So if you don't come to your second dose appointment, or if you decide to go to Florida or something like that, then you might miss it. But otherwise, you are guaranteed that second dose. So no worries.
Thank you. Dr. Hassouna, this next question would be for you. How long is the vaccine effective? Will booster shots be necessary?
Currently, we do not know the answer to this question and how long the protection is still there or if we'll require booster shot. However, there are ongoing trials looking at that, and we will have that information hopefully in the future.
Thank you. Our next question is, when and where will the vaccine be available? Will my family members be able to get the vaccine? And I think this means Grand Valley related. So Tina, if you could answer this one.
Sure. So, you know, as we've mentioned, vaccine availability is certainly the primary challenge that we're facing right now. And we don't know for sure when it will become widely available. There's certainly been some comments recently that maybe late spring or into the summer. But, you know, we will continue to work with our different groups, you know, as the prioritization schedules are released. But we continue to work closely with the health departments and the health systems, as I've mentioned. We will offer vaccine clinics. And then as Marcia referenced, there is the Vaccinate West Michigan site where you can register to get a vaccine, to get on the list, so that as your prioritization group becomes available, you'll get information about how to schedule an appointment for a vaccine. Our Lakers Together website has a section on vaccinations, and we do link to that site. So I encourage people to use that site if you're not currently on a list, you know, to get on a list. When we host our vaccine clinics, I think our timing and our partners will, and where we are in the prioritization schedules will determine whether it's going to be a broad community-wide clinics or whether they will be very specific to Grand Valley and individuals that hold a Grand Valley ID. But again, as those details become worked out, we will communicate that as broadly as we possibly can.
Thank you, Tina. We may have answered this along the way, but it's worth maybe repeating. Which vaccine will be offered, and will participants have a choice? So Marcia and Dr. Hassouna.
So as Dr. Hassouna so clearly explained to us, we have two vaccines right now, and they're both equally safe and effective, basically. So we have Pfizer and Moderna. Johnson & Johnson is undergoing emergency use authorization approval with the FDA. And at some point, if the FDA decides to grant that EUA, that will be available. But right now we have two. And from my experience, I can tell you that we do not know which vaccine we're going to get in any given week or how much of it we're going to get. We've never gotten the same amount or the same combination of Pfizer and Moderna in any 2-week period. So right now, I would say you don't really have a choice, but that really shouldn't matter. It shouldn't be a concern to you, because it's most important that you take an opportunity to get the vaccine if you are a member of one of the current priority groups or one that is coming up. They will all be much more important for you to have than COVID-19. So we want to prevent that. So don't be too concerned. Possibly eventually, when there are more types of vaccines available and a lot more supply and a lot more places giving it, you might be able to, pick one over another if you want to get a certain one, but I wouldn't worry about it right now.
I would only add that, as we said, those vaccines, the general recommendation, the mechanism of action, the safety, the efficacy are really quite similar. And the main differences so far are mainly in the distribution, the shipment storage, the temperature needed for storage. So it's mainly the changes would be just affecting the hospitals rather than the individuals themselves that are receiving that, and like the shipment size. Now, aside from the age difference, where Pfizer was approved for people above the age of 16, like 16 and above, and Moderna for 18 and above, there's not much quite differences. I know that people, and it didn't show that one vaccine was better suited for one population over the other. I know we tend to ask family, friends, which vaccine did you take? But honestly, there's no difference. Just take whatever is available for you in times of limited supply.
Thank you. We are having, this is a question that was posed before and is also in the chat. Will Grand Valley prioritize who gets the vaccine first? And will those in face-to-face interactions receive it first? So Marcia and Tina, how about if you answer this one?
So I'll kind of kick off, and then Marcia can pick up if that works. So the prioritization categories are actually set by the federal and state agencies. And so obviously we're going to follow that and work closely with our health departments and our hospital systems as our people are eligible within the current frameworks. I mentioned health profession students as an example, of that. And then as each phase opens, if we had the opportunity to facilitate for our community, we certainly will do so. In general, as each of those phases has opened, individuals who have face-to-face contact are generally prioritized prior to individuals who have more limited contact. And so again, we will work with the health department as that comes up and as we offer our own clinics and work those exact details out. So Marcia, I don't know if you have anything you want to add to that.
Not really. You did a really good job of covering it. It's really supply dependent. And so if we have a limited supply, then we have to prioritize. Then we do exactly what you said. We try to get to people who have in-person interaction. If we have large supply, then we don't have to do that kind of prioritization.
Thank you both. Has anyone at Grand Valley been vaccinated, and will the vaccine be mandatory? Ed, could you answer this one?
Sure. Thank you, Dottie. As far as the first question, back in a few months ago, we added some new questions to the daily self-assessment to ask people if they've received one or both doses. And so first, I'm going to encourage people to actually keep doing the daily self-assessment, and if you get vaccinated, to report that, because that's the data that we have to work with. Based on the data so far, we have had 1,400 members of the Grand Valley community who've received either 1 or 2 doses. And it's at this point, it's more that have received 2 doses than 1 dose. Who are these people? I mean, they're faculty, staff, and their students. They are the ones that were in the highest priority categories from the state of Michigan that we've been talking about. So those that are over 65, workers in public safety, faculty, staff, and students in health areas that are interacting with hospitals or other health providers. Also, those who are involved with the K-12 schools. There are individuals who are running our testing program, which that was another group. And then others on the high priority list, such as those with certain risk factors or pre-existing conditions. To be clear, first of all, on the self-assessment, we can't tell which category that I just described is there. But also, all these people have gotten those vaccinations outside of our campus, other than the clinic that we have in Holland. So will the vaccine be mandatory? Well, let me say two things to preface my answer to that. One is that any decisions about that will be informed by the guidance that we get from the local, state, and federal health officials. That's really important. We've been working with them all along, as Marcia has said, and we will continue to do so. The other is that getting vaccinated is a good thing. The more people who are vaccinated, the closer we get to normal, right, in terms of having the type of community that we're used to here at the university. So in terms of having said this, and also it's hard to predict exactly what things are going to look like in July or August or so on. I can say that, we have not required other vaccines. We don't require flu shots, for instance. And we don't anticipate requiring COVID vaccination. But again, that could change depending on conditions once we get to later in the summer.
Thank you, Ed. You may be able to help with this next one. Why did K-12 teachers and staff get the vaccine, but not college faculty and staff? And what has Grand Valley done about this?
Sure. I guess I can explain what we understand about the decision. And part of it is a decision at the state level, trying to balance reducing hospitalizations and deaths and getting our economy going. So the reduction of hospitalizations and death is why there's been a focus on those over 65, those with pre-existing conditions, and so on. And then getting our economy going is why, for instance, there's been a focus on the K-12 schools. If we get the K-12 schools open, where the students are going to school, to class, this frees up parents for working and so on. And then the focus on essential workers, however that's defined, has also been a part of trying to get our economy going. Unfortunately, there's not been the same sense of urgency about colleges and universities. And that's like I said, it's unfortunate. We've been lobbying for that. And when I say we, there's an organization that Grand Valley belongs to called MASU, which is the Michigan Association of State Universities. And they have been, since October, have been trying to make the case to the decision makers in Lansing that our faculty and staff, particularly those who are primarily in face-to-face interactions, are just as should be prioritized the same way that the K-12 teachers and staff should be. Unfortunately, they've not been able to convince the powers that be about that. We also talk to Marcia and others from Kent County and Ottawa County regularly, the health officials, about these matters with the goal of them passing that up the chain. And Marcia, do you want to say more about that?
Sure.
Yes.
I'd love to step in, and I want to take the responsibility off the shoulders of Grand Valley State University for whether or not your faculty and students and staff can get vaccinated, because that really is out of your hands. That is a public health official decision, and it's based on equity and risk and limited supply. Again, I keep saying this, and I sound like a tape that's just replaying. But when you have limited supply, then you have to prioritize, and you have to do it based on some criteria. And I think the criteria are sound. Now, I do want to add that it's pretty darn exciting in public health to have people clamoring to get vaccine, to be so supportive of it and so excited to get it. So hold on to that eagerness. And I can tell you, you will get your vaccine. We definitely want everyone to get it. And it's important for everyone. But again, with limited supply, we have to prioritize. And I think Ed explained it well, why K through 12 first before higher education.
Thank you, Ed and Marcia. We have a question asking if we know what our plans for fall 2021 will look like, especially in regard to face-to-face classes, if you know that, Ed.
Well, I can tell you what the plans are right now. And as I said a few minutes ago, things depend on conditions, and conditions may change. In academic and student affairs, there's been work by faculty and unit heads and deans and provost office and so on for a few months now, in the registrar's office too, to set up course schedules for fall 2021. There's something called Plan A and Plan B. And Plan A is the one that is soon going to go live on the registrar site, which is a primarily face-to-face schedule. Of the scheduled courses, the regular courses, about 3/4 of them are face-to-face, and the other quarter are either hybrid or online. So that is the plan we are pursuing right now. But departments are also asked to create Plan B, which looks a lot more like how fall 2020 looked, where there's predominantly online courses, either remote courses or hybrid courses. And there will be, so we'll be set up if we need to pivot, if we have to, if the pandemic continues. A final decision about that wouldn't occur until sometime in the summer, and that actually would be a decision made at the highest levels.
Our next question, Ed, could go to you, and maybe Greg, if you have information to add. What would fall look like if the majority of people have been vaccinated by fall?
Greg, do you want to go first on this?
Sure. Yep.
Yeah.
I can do that. The question is, if what does back to work look like? I think is the essence of that question. And I think that, it's important that our low density on campus and our workspace has been part of our strategy to limit the spread. I mean, we have not had, one of the concerns, we have not had spread of the virus in our workspaces on campus or in our classrooms. And that's because of the social distancing measures that we have in place, the plexiglass barriers and things like that. So it's working. So what does it look like when, say, the majority of the Grand Valley population has been vaccinated? Well, it's important that, we need to follow the health department guidelines, both from the state and from the county. MIOSHA will have a big say in that and what our workspaces look like, obviously, and also CDC recommendations. So we'll continue to follow all of those. But it's, and the most important thing is we got to stay consistent to our mission. And our mission is, what makes Grand Valley, what makes it a special place is that high interaction that we have with our students. So we will take into consideration the guidance from the health departments, the CDC, MIOSHA, as we look to repopulate the workspaces on campus. And we'll be sure to communicate that. Before COVID, we had a remote work policy. It was not widely used. Most people weren't comfortable with it. To be honest with you, supervisors weren't, just because it was different. But I think one of the things that we've learned through COVID, and we can do a lot of our work remotely. And so I would fully expect that with the lessons learned through this experience, we're already working in HR to kind of beef up our remote work policy. And I would expect that there would be certainly more remote work after everybody's vaccinated and all the restrictions from MIOSHA and the health department have been lifted with regards to our workspace. We'll just have to see. And what will happen, though, is it really is going to come down to the nature of the individual's work, whether or not they can do that work from home or remote, or whether or not they need to be in that face-to-face environment. But it's about, what makes Grand Valley. It's our personal interaction, and it's our sense of community. But we will certainly take away a lot of lessons learned from our ability to work remote during the pandemic. Is there anything you'd like to add, Ed?
Yes, thanks. Let's be clear that this has been a difficult year, right? Since last early March, in terms of the pandemic, all the different shifts we've gone through as a university, the fear about coronavirus, and a realization among, I think, the whole community that, when we talk about the college experience for our students, there's more than just what happens in class, whether that class is face-to-face or through something like Zoom. There are a lot of informal interactions that occur with faculty and with other students. There's a lot else that happens on campus. And, so knowing that and realizing the importance of those interactions, there's a real desire to see this fall look a lot more like the way things used to be. And a combination of vaccination, of continuing our process to keep the virus at bay and so on, are ways to do that. At the same time, the university has expanded its mission to have more students and learners, either on campus or off remotely. Our curriculum is evolving, where there's more online experiences. And I think one thing we have learned from the past year is some ways to do that better and some ways to avoid in the future.
Thank you, Tina and Marcia. I believe this next question would be for you. Should we be double masking?
So the most important thing any of us can do is to wear a face covering that's kind of meets some of the minimum requirements. At least 2 layers, tightly woven, breathable fabric, washable, or a medical, or some people call them procedure masks. But in either case, it's important that that mask covers your mouth and your nose and it fits snugly against your face. With the emergence of the variants, that Dr. Hassouna alluded to earlier, double masking has become more of a conversation. And they're appropriate when you're in environments where you cannot consistently social distance. So if you can't maintain that 6 feet, if you're going to be in a little bit more crowded environment, then double masking is something that should be considered. And when you think about double masking, generally that's, that procedure or medical grade mask, medical mask with the cloth mask over top of it. And that's because it gives you 2 things. One, it gives you that additional filtration. So you're now talking about a 4 or 5 layer of filtration. But then the cloth mask tends to help hold that procedure mask a little tighter against your face. The CDC's got a great site that looks at masks and talks about different ways to help make a mask fit a little better. You can twist the loops a little bit, and there's a tuck procedure you can do and stuff like that. But it's really about whatever you're wearing, that it's multiple layers, that it covers your mouth and your nose, and that it fits snugly. Marcia, I don't know if you've got additional information that you can add to that.
That was fantastic, Tina. I mean, it's a good conversation for us to be having right now, but what really will matter is if guidance changes that tells us we need to be wearing a double mask, or orders change that say we have to be wearing a double mask. But until then, following your guidelines are exactly right.
Thank you. Marcia, you may be able to help with this next one. What's the best way for students to receive a vaccine, especially those who might be taking all online classes? Does that matter? And is there a fee?
Well, I'll take the fee part first, because that really applies to everyone. The vaccine is a federal asset. So no one who is giving it is buying it. So it doesn't belong to the health department. It doesn't belong to the hospital. It doesn't belong to the pharmacy. And there should be no barrier to anyone getting the vaccine. So there should not be any fee for you. Now, it's possible that a hospital or a pharmacy or a health department might charge an administrative fee of their cost to running the clinic or whatever, but that would only be charged to your insurance if you have insurance and if it covers that. If it doesn't, or you don't have insurance, there should be no charge at all. So I want everyone to understand that, because I don't want that to be a barrier for hesitating to get the vaccine if it's available to you. As far as the best way for students to receive the vaccine, Grand Valley's been a great advocate in letting health departments know when they have groups at their campus that they feel fit into one of the priority areas. And one of those that they raised early were their students who were doing clinicals and healthcare courses that were going to be in long-term care facilities or in hospitals or in doctors' offices. And they are properly healthcare staff at that point and are coming in contact with people who could be infected, and as well as educators. So kids that are students that are doing student teaching or student assisting. So, those students should have already gotten that, and they're usually working with Grand Valley staff and faculty to make those arrangements. When you hear that your priority group is now available or open, then you can start listening to the news and looking for possible emails to come into you if you've registered for vaccine. So it'll be a while before we get to the general population. I'm not going to say when, because I don't want anyone to hold me to it. My crystal ball is completely broken. So it's not working anymore. But you will know, I would anticipate that it will be quite a wait. So no time real soon, since most of your students are going to fall in the 18 to 25 age category.
Thank you, Marcia. I have a couple follow-up questions from the Q&A section. So some are asking, is it okay or should I register at various different places for the vaccine while I wait to see who might have it for me? Or should I register just at one place?
That's a really good question. And I'll give you some answer. So you might get a different answer from someone else, but this would be my strategy. I would register at every place that's a reasonable for me to get to. Now, that said, I would very strongly discourage you from making more than one vaccination appointment. Do not do that, because if you do that, you are taking a spot away from someone else. So only make one appointment, and then you might get communication from places that you have registered at once you get your appointment, and they might have an option that allows you to respond back and say, I've already gotten my vaccine, you can take me off this, or you can unsubscribe or something like that. But until that happens, please take advantage of anywhere that you can get a vaccine as part of a group that's eligible for it.
Thank you. Our next question, can someone address vaccine hesitancy and inequities? So maybe Marcia and Dr. Hassouna?
Sure. I mean, vaccine hesitancy has definitely been a barrier to vaccination, especially among certain populations, such as our African American community. Now, according to the to the CDC, this pandemic has showed us that COVID-19 infection has hit our African American population at an incidence that was 2.6 times higher than our white population. And that was also the same case for our Hispanic community, where it was hit by the COVID-19 infection 2.8 times more as compared to the white population. And this, I understand that decades of discrimination by the healthcare system has left certain populations and minorities mistrustful of the doctors and the healthcare system. However, this is one method where it shows that the use of an effective vaccine can be one way to decrease, even if it does not eliminate, but at least decrease the racial disparities among different population. And especially that the COVID-19 vaccine has proved to be so far effective for different population, especially that the trials have involved people from all races with similar efficacy. I cannot stress enough or recommend enough the importance of reconsidering people to reconsider their decision about taking COVID-19 vaccine, or at least discussing it with their healthcare providers. Because right now the virus has showed us that it does not discriminate against I guess one person more than the other. Thus, we are all prone to get it. I know some people are prone more than others, and this is why this population should be more enthusiastic about getting the vaccine more than others.
Thank you, Doctor. That's great. Great information. And I would just add, from an Ottawa County perspective, I mean, our largest population of color would be the Hispanic ethnicity. And we did see a disparity in cases. There was a higher proportion of Hispanic cases among all cases than there were in the population as a proportion of our population. We did not see that with deaths and hospitalizations, gratefully. But we and everyone else is keeping a really close eye on inequities or equity in vaccination access. And we can assume that there is not equal ability to access vaccine, that just everyone is different. There are people who have transportation barriers, who have physical barriers, who may have communication barriers. And right now, in the world we live in, a lot of this is being done by technology. So they may not have access to technology or to an internet. And so it is the mission of public health to remove barriers to health. And so that is why, you know, vaccine is being initiated in hospital systems and public health systems, so that we can address those inequities. Now, with the priority groups that we've had so far, like healthcare personnel, first responders, education staff, long-term care facility staff and residents, there's not a lot we can do. They are who they are. You either belong to one of those categories or you don't belong to one of those categories. So we can't do a lot of work with removing barriers to inequitable access. But as we have moved into more like the general population, where we're vaccinating people ages 65 and older, we have made, all of us in this area, real efforts to make sure that there's equity in accessing vaccine for that population. And And Ottawa County has been watching that very carefully. We have 6.2% of our 65 and older population who are people of color, and we've actually vaccinated 8.7% of them in our clinics. So that shows us at least that the efforts we're making are having a good result. I mean, we'll keep working on improving that. But I echo Dr. Hassouna, and that the virus doesn't discriminate. And so please, take an opportunity to get the vaccine. Talk to your doctor about it if you're concerned. But the risk of COVID-19 is greater than the risk of the vaccine. That's where the evidence points.
Thank you. We have several people in the Q&A right now asking that when Grand Valley is able to have a vaccine clinic, when we receive vaccine, where will those locations be? Will it only be in Allendale? Will it include other campuses? And also, will RAs be a priority on that list?
Sure, I can take that question. We're looking at all options to bring the vaccine to our campus community as quickly as possible. It's really going to come down to availability of the vaccine, and then obviously, and with the partnership with the health department or potentially a local hospital system or something. But again, we still got to follow the state priority system, even when we have that clinic set up. So at some point, we're going to get to that between 18 and 55 with that group, and then I would expect a very widespread, huge type clinic, first come, first serve when we get there. But we'll continue to follow the state prioritization system, and we'll get it set up. Again, it just comes down to vaccine availability right now. But we're ready. Like I said earlier, we've got the freezer. We've looked at some sites. We're ready to go. Once we have the vaccine, we're ready to wave the checkered flag and say go.
Thank you. Someone else is asking, if I have already had COVID-19, should I get the vaccine? And if so, is there a waiting period between having COVID and getting the vaccine?
I'll take that one. Thank you, Dottie. I think this is a very important question. And this is why I alluded previously in the studies that they even looked at about whether people took the COVID, had COVID or not. Yes, people who had COVID-19 infection are still encouraged to take the vaccine. Now, the recommendation right now is that once you are out of your isolation period or your isolation recommendations or precautions, this is where you can safely take your COVID vaccine. This is where you're no longer have symptoms and you're out of the isolation. That way you do not expose providers that are providing this vaccine to the virus. Now, one important point though to mention is that people who were critically ill for COVID-19 infection and has received as part of their treatment convalescent plasma or monoclonal antibodies, those are advised to wait 90 days instead of just the isolation period. And that was because it's thought that the convalescent plasma and the monoclonal antibodies can decrease the effect of the vaccine. So even if you get COVID-19 infection between your first dose and the second dose, once you're better and out of the isolation standards, you can still go ahead and schedule your second dose or go and get it because it will be scheduled for you technically.
Thank you. And you may be answering this one as well. A couple people are asking, and we kind of touched on it earlier, but bears repeating. Once you have the vaccine, are you immune from getting COVID?
This is a very good question. So far, even when they are testing, like in the studies, the neutralizing antibodies against that virus, we still do not really know if that can be interpreted against immunity. But this is why we have said that at least it decreases the symptomatic infection and the severe disease. So it would be hard to just translate that and said you are immune, but again, it's 95% effective in decreasing your risk of acquiring COVID-19 infection, I would say, and the severity of it. There's still a small chance of transmitting it to others because you're asymptomatic. But again, we have to keep in mind, there's no vaccine or treatment that is 100% effective or safe. And this is why we are per the CDC, we are still requiring people to take the social measures and the masking. Now, that said, at least I know that some people might ask, why are we then taking the vaccine? I think the easiest way to put it is that because we're trying to change COVID-19 virus from being a global threat and killing a lot of people to just maybe making it just a regular respiratory virus that we get and we does not necessarily been translated into a lot of death. So we're kind of trying to get it under control, I would say.
And I want to leave some time. We have a few minutes left for Greg's closing remarks, but quickly, Dr. Hassouna, playing off of that, a few people are also asking that, can you get COVID more than once? And after you've had it, is it still the 90-day immunity before possibly getting it again while you wait for a vaccine?
This is a very good question. We know that COVID-19, once you get COVID, there's a little risk of reinfection. Preliminary studies have shown that the risk of reinfection is mostly around after the 90-day period. However, there were still some cases where within the 90-day period that they did have the reinfection. And this is why we only recommend people to get tested if they have symptoms. Now, the good thing that I want to stress for people is that right now, the recommendation from the CDC, if you got your vaccine and you got exposed and you have no symptoms for 90 days after receiving the vaccine and after the immune response has happened, like 14 days after taking your second dose, you no longer have to quarantine. Unless you develop symptoms or to get tested again, just because that's thought that it decreases the risk. The initial recommendation, due to the limited supply, if you get COVID, maybe you can wait 90 days, but right now the recommendation, as we said, if it's available for you, just go ahead and get it, especially with the new strains, because there's a risk of reinfection.
Thank you. Greg, if you'd like to start your closing remarks.
Thanks, Dottie. And I want to thank everybody on the panel today. And also the audience for taking the time to listen and submit your questions. Again, it's the COVID on campus. We've been doing a fantastic job this semester. Our numbers are down way low, and that's really attributable to the entire campus community doing their part with masking and social distancing and the reduced density that we have on campus. We're not out of the woods yet, but we really feel like we're close. And we're starting to talk about the vaccine. We're starting to talk about plans for fall, which would look very different than last fall. And I think that's a great sense of optimism. I know it's been a difficult and trying time for our entire community, just so much with the uncertainty and when is this going to end? But I think we're close. I think the vaccine is the next big step, and we're doing everything we can to get the vaccine as quickly as possible to our entire community. And we're doing that through our relationships with the health department and the local hospital systems. We're not there yet. We've still got some time. Please don't let down your guard now. Continue to wear those masks, continue to socially distance, and we'll be in touch. I encourage you to read our VAT emails. Dottie drafts those up for us every week, and they're really packed with a lot of information. And we'll be sure to communicate just as soon as we know when we're ready to do a Grand Valley clinic to provide the vaccine to a wide swath of our community. But until then, if you get the opportunity to get the vaccine somewhere else, please do that. And then let us know on your self-assessment so we can continue to track that. So again, I thank everybody on the panel, and I thank our entire community for doing their part. We can't do it without everybody working together. So thank you.